A rise in teenage pregnancies and abortions in Gauteng has become a cause of concern. The highest number of cases are reportedly in Ekurhuleni. Civil society and government have raised the alarm and are calling for intervention. And to discuss this, I'm now joined by Love Life Gauteng Provincial Manager, Thilivhali. Livhadi, thank you so much for joining us. Welcome. And first and foremost, the Department of Health has noted an increase in teenage pregnancies to 24,941 in the 2022-2023 period. What should we attribute this staggering increase to?
Good afternoon, and good afternoon to the viewers. We attribute the increase of the new teenage pregnancy in the province due to environmental factors as well, where we have young people who are staying in informal settlement where there's no a conducive family structure, where young people are able to have a good advices on how to conduct themselves as teenagers in a case where you find there's a very same family because of social economic factors staying in one room with parents. So it has an element of influencing young teenagers into unwanted sexual behaviors at the wrong time. We attribute this to also extramural activities that are lacking in the province. In a case where you find young people after school, they linger around without other activities to do, like soccer or other sports activities that they can involve themselves in. In case where there's infrastructure, you'll find the infrastructure for such activities being vandalized and not being utilized. We attribute that also to misinformation in terms of services at healthcare facilities, where you find when young people are approaching or going to the clinics, they are told of one way of contraceptives, whereas there are different contraceptive methods that they can opt for as young people. And this is due to lack of a proper information by healthcare workers at facilities. So this is also something that is contributing. You'll find that they are only telling them about oral contraceptive, whereas there are other options like hormonal contraceptive and also injectables, where young people are not exposed to these other options. You also find other facilities not very youth-friendly, where young people can easily access and talk about what they feel or how they feel about their bodies and also their sexual reproductive health and rights issues. So these are some of the contributing factors that are leading into the high number of teenage pregnancy in the province.
Yeah, that was actually an angle that I wanted to explore a little bit more when it comes to the current attitudes towards young people and how accessible these clinics are currently. Have we evolved in terms of the attitude of nurses, the comfortability of young people to actually approach clinics openly and freely?
Yes, there is an enormous, increase and a move towards our facilities being youth-friendly in the province. The challenge that we see is that you would find that we have a program called Adolescent Youth Friendly Services, where we have created some youth zones together with the Department of Health. Then we would have a champion who is a nurse, and particularly we identify young nurses so that they are able to communicate easily, like a peer-to-peer model. So you would find that in most instances, these young nurses would move around because of career opportunities, and then you have to change and have another one, and that delays the process of making sure that the clinic or a health center is completely user-friendly to young people.
And in what ways, if any, Thilivhali, are we, if not documenting these occurrences, but also trying to find more active solutions towards creating more youth-friendly clinics?
Yes, for this point, we need to applaud the Department of Health in the province, because today, as I'm speaking, they are launching a teenage pregnancy strategy that is comprehensive and it's involving all stakeholders that are involved in the eradication of teenage social development, and all stakeholders like partners like Love Life, ANOVA, and also community members, and importantly, school governing bodies, because we have challenges in some instances where they misunderstand comprehensive sexuality education to sex education in school. So we are moving towards the right position or to the right direction in terms of eradicating teenage pregnancy in the province.
All right, that sounds incredibly positive. Thank you so much for your time. And that was Thilivhali, Livhadi, the Love Life Gauteng Provincial Manager, just talking to us about these new statistics that were recently released from the Office of the Gauteng MEC for Health and Wellness, Ms. Nomantunkomo Rale Hoko. He spoke of multiple problems that to me sound like they require multiple solutions over and above the Department of Health. I mean, the family structure, the lack of extramural activities. Of course, that's a story that we will continue to explore further.